I'm Marcia and I work at the Tamarind Centre. I'm the CEO at the Tamarind Centre and I'm also the co-chair of the Pcref NHS group. I'd like to talk about what Pcref means to myself and the community, because Pcref, as we know, stands for Patient and Carer Race Equality Framework. It's a groundbreaking initiative by the NHS aimed at tackling racial inequalities in mental health care. It's the first time anti-racism framework in the NHS mental health services, and it's designed to ensure that trusts and providers actively work towards becoming anti-racist organisations. And I think generally for our community that I support, which is all racialised groups really, this is really important because a lot of the times race is not actually monitored. Data transparency is one of the key areas that this is focusing on, and also feedback mechanisms. Patient and carers from our communities have a clear way to provide feedback with the visible process to act on their concerns in regards to mental health services and the way they're being treated. And generally, Patient and Carer Race Equality Framework, Pcref, is all about co-production, and it means that communities, patients and carers are at the heart of shaping services. And it's not just about policy, it's about real change. And when we say real change, we mean rather than from top down, where you have the NHS at the top and they're working their way down to actually put their systems in place, it's a joint process in co-production whereby we have a bottom-up approach also. So the top and the bottom, and our services are usually classed as the ones that are at the bottom, and they're coming in the middle to meet and then to provide a mental health care that's inclusive, equitable and culturally responsive. Why is Pcref important? It's one of the most crucial initiatives, I think, since the Delivering Race Equality Agenda 2010 that happened, and it's tackling racial disparities in mental health care. And as a mental health charity, this is really important. The amount of times we've seen people not being treated within the realms of their cultural appropriateness and responsive to the needs of diverse communities. By engaging with Pcref, it empowers communities and individual organisations. We can have an impact and be included of future policy and services for the better for the needs of the people who we're supporting. The issues that Pcref address and the difference it can make within the communities is racial inequalities in mental health care, where we know Black and Black Asian groups are 4 to 5 times more likely to be detained under the Mental Health Act than their white counterparts. Higher rates of restraint and criminal justice involvement and the lack of cultural appropriate care. It's really good that we're actually working with the NHS on the Patient and Carer Race Equality Framework to bring the actions forward. And the difference that this can make is improve access and outcomes for people from racialised groups, and they'll receive better support and treatment. Cultural competency training, providing staff and anti-racism and cultural awareness training to enhance service delivery, and accountability and governance within the NHS and also other services as well. What's I think is really positive as well about this new initiative is it's being rolled out in the NHS, and also it's going to be part of the CQC, the Care Quality Commission inspection. It gives people that bit more confidence to know that at least it's going to be monitored somewhere else, and the disparities that have been happening for a very long time will actually be monitored and brought to light and be highlighted sooner.
I really want to reassure you that we are absolutely committed as an organization to listen to you, to work with you, to rebuild that trust that I know may be lost. I really want you to have that confidence that when we say we'll work together to put things right, we are determined to do it, and that we will do it and we'll see it through. And no, we're not going to be able to do it on our own. And there's no way we can do this on our own, because in order to tackle the sort of challenges that we've got and we know have existed over decades, it's not something that one organization can do. And I know we've got we've got some really good relationships locally, and I would really want us to build on that. If you want to get involved, please contact me directly, and I'll put you in touch with other people who we are working with as part of this work. Thank you.